Hi, my name is Bree Cower, and today we're going to be talking about person-centered therapy. Person-centered therapy is based on a philosophy of human nature that postulates an innate striving for self-actualization. By the end of this presentation, you should be able to analyze the person-centered therapy approach to psychotherapy, apply the person-centered approach in a crisis and group setting, understand and identify techniques and tools to use in professional practice, and understand the evidence and goals for person-centered therapy. Person-centered therapy is developed by Carl Rogers. This approach was developed during the 1940s as a non-directive reaction against psychoanalysis. It's based on a subjective view of human experience. It places faith in and gives responsibility to the client in dealing with problems and concerns. Person-centered therapy has views of human nature. This says that at their core, humans are trustworthy and positive. Humans are capable of making changes and living productive, effective lives. Humans innately gravitate towards self-actualization, and given the right growth fostering conditions, individuals strive to move forward and fulfill their creative nature. This approach challenges assumptions that the counselor knows best, validity of evidence, suggestion, persuasion, teaching, diagnosis, and interpretation, belief that clients cannot resolve their own problems without help, and focus on problems over persons. This approach emphasizes personal characteristics of the therapist, quality of the therapeutic relationship, counselor's creation of a growth-promoting climate, person's capacity for self-directed growth if involved in a therapeutic relationship, and it serves as a model of human being struggling toward greater realness. So Rogers, in 1967, hypothesized that significant positive personality changes does not occur except in a relationship. Rogers' hypothesis was formulated on the basis of many years of professional experience, and it remains basically unchanged to this day. Rogers thought that each person exists within an ever-changing world in which he or she is in the center. He believed that the self is not a fixed structure, but a structure and process capable of both stability and changes. The self is a concept or a map that the person develops and helps navigate their world. There are 6 conditions that are necessary and sufficient for personality change to occur. 1, 2 persons are in a psychological contact. 2, the person, the client, is experiencing incongruence. 3, the second person, the therapist, is congruent or integrated into the relationship. 4, the therapist experiences unconditional positive regard or really caring for the client. 5, the therapist experiences empathy for the client's internal frame of reference and endeavors to communicate this to the client. And 6, the communication to the client is to a minimal degree achieved. So what is Rogers' theory of psychopathology? So psychopathology can be a discrepancy between the real self and the ideal self. There's rigid thoughts that impair learning and the failure to learn from experience. People learn to hold parts of their self-concept rigidly when parents, teachers, or cultures impose conditions of worth on them. They are made to feel that they are worthwhile only when they conform to other standards and values. This incongruence results between rigid shoulds and the true experience of self. So the person-centered therapist should be genuine, integrated, and authentic. They should focus on the quality of the therapeutic relationship, the client, and know that the client is the agent of change and healing, not the therapist. They should engage in co-assessment and should tell their clients to openly express feelings and attitudes that are present in the relationship with the client. They should also be invested in developing their own life experiences to deepen self-knowledge and move towards self-actualization. So what are some techniques that can be used with doing person-centered therapy? So first is being non-directive. Unlike most therapies where a clinician may have an agenda for a particular session, a person-centered therapist lets the client lead. It's the client's journey, and it is believed that they are experts about their own lives. Thus, the therapist is seen as an equal collaborator rather than authority who knows how to guide a person towards self-actualization. This is the reason that Rogers referred to a person in therapy as a client rather than a patient. Although it may be tempting to offer guidance, it is important that the client is taking responsibility for their own life. The next is unconditional positive regard. One of the most important aspects of person-centered therapy technique is that the therapist must exhibit unconditional positive regard for their client. In short, this means that they accept and care for the client as they are. This does not mean that the therapist always has to agree with what the client does or mean, but they need to refrain from judgment. It is essential that the client feels valued by the therapist. You might note that this resembles aspects of positive psychology. Rogers was definitely ahead of his time. Next is congruence. Congruence is the development of self-concept as a key to Rogers. In order to be functioning as an optimal level, he thought that a person must balance their ideal self with how they experience their real self. When that is achieved, they obtain what he termed congruence. He believed congruence was necessary to becoming a highly functioning person and achieve life goals. It is thought that a client is usually in a state of congruence when they enter therapy, and a major part of work that is to achieve congruence. In order to be effective, a client needs to believe that a therapist is saying is true. This is major diversion from much of psychodynamic psychology, where therapists were encouraged to hide their true selves from patients. Being genuine allows the therapist and client to build trust and models a healthy relationship. If a therapist is not exhibiting congruence, a client will not be able to achieve a similar state. Last is empathy. Empathy is the ability to put yourself in someone's shoes and relate to their experience. It should be noted that empathy is different from sympathy. Empathy is showing understanding for a person, while sympathy is feeling bad for them. If a client does not feel understood, they will not feel safe with a therapist and will be unable to be genuine and exhibit their true self. Here are some tools that I found that can be used in practice with person-centered therapy, and this will be given at the beginning of the session and at the end of the session. So at the beginning of the session, this would kind of be like, all right, after you've seen them for your first visit, you'll give them an outcome rating scale for the things that they've improved over the week. And the outcome rating scale is a short questionnaire developed by Scott D. Miller that assesses how well a person has been doing individually, interpersonally, socially, and over well-being during the last week. So this kind of gives you an assessment of how well they have been using or thinking about the things that you talked about with their last visit. And after you get done with a session, one important thing that you can do is do a session rating scale, and this will give you feedback on meeting your patient's expectations or educating the patient on the expected expectations that they should have. So, they may want you to be doing more talking than what they're doing. So you may have to teach them that in order for them to learn, they need to do most of the talking and understanding what's going on in their life. So how can you apply this to a crisis intervention? So when people are in crisis, one of the first steps is to give them an opportunity to fully express themselves. You want to let them get it all out. It might be called word vomit, but let them all get everything out that they need to talk about. You want to show them genuine support, caring, and non-possessive warmth. And this can help motivate people to do something to work through their crisis. You want to communicate a deep sense of understanding, and you should always precede other problem-solving interventions. One reason clients seek therapy is a feeling of basic helplessness, powerlessness, and the inability to make decisions or effectively direct their own lives. They may hope to find the way through the guidance of the therapist. Within the person-centered framework, however, clients soon learn that they can be responsible for themselves and the relationship, and that they can learn to be more free by using the relationship to gain greater self-understanding. So how can we apply this to group counseling? So therapists take on the role of the facilitator who creates a therapeutic environment. Their techniques are not stressed. You want to exhibit deep trust for the group members, and the responsibility for the direction of the group is on the members who set the goals for the group. You want to provide support for the group, and you want to have the group setting as open and as an accepting community. Individuals learn that they have to experience the process of change alone and grow with the support from the group members. So from evidence, recent research has shown that the effectiveness of person-centered therapy has yielded some positive results. It's shown that person-centered therapy is consistently more effective than no treatment at all. It is more effective than the placebo treatment and is less effective than structured cognitive and behavioral treatments. So what do you want the goals of therapy to be for your patient? So you want your patient to become more open to experience, achieve self-trust, develop an internal source of evaluation, and be willing to continue to grow. Specific goals are not suggested for clients, rather clients choose their own values and their own goals. These are my sources, and you have a great day.